Now, I'd like to introduce your speaker for today, Dr. Sarah Silcox, who will be joining us at the end of the presentation for a live Q&A. Welcome, Dr. Silcox.
Thank you so much. And good morning, everyone. I see we've got lots of people listening and watching in this morning. So thanks so much for taking the time to come out. This new world of virtual presenting is certainly a big change for a lot of us. So I hope everything goes smoothly today. Fingers crossed. For those of you who don't know me, I'm Dr. Sarah Silcox. I'm a small animal veterinarian and an OBC 97 grad. I've worked in lots of different aspects of practice over the years. I started out in a fabulous multi-doctor small animal practice. I then started doing some part-time work in Emerge. My practice I was working at allowed me to start getting my feet wet and exploring integrative medicine. And so several years after being in general practice, I opened up an integrative medicine house call practice, while still offering part-time emergency care, as well as a brief stint for about a year or two doing some locum work. And then about 3 years ago, I decided to focus my attention on palliative and hospice practice. And it was right around that time I got asked to speak at a conference on using cannabis for pets. And that was the first step in what turned out to be a big life change, as it led to the foundation of the Canadian Association of Veterinary Cannabinoid Medicine, where, as you heard, I currently serve as one of the founding directors as well as the current president. So I hope today is going to help you guys feel a little bit more comfortable about talking about cannabis with your clients and just having a better understanding of where we stand legally and regulatory speaking. And so let's get started with that. All right, who remembers this? It seems like a lifetime ago, where we actually had these face-to-face discussions with our clients, but that's really what today's talk is going to be about, is talking with our clients. And I'm sure if some of you were present for Dr. Mosley's awesome presentation this morning, you're probably pretty stoked about the potential uses of cannabis for a lot of our patients. But there may still be a little bit of confusion about what to tell clients asking about cannabis, where to direct them for products, the differences between legal and black market products. So hopefully we can answer some of those questions for you. Today's talk is really going to be broken into two sections. The first one looking at legal cannabis in Canada. So which products are legal? What are the legal channels for accessing them? And then secondly, once we know which products are legal, understanding some of the product differences, understanding some of the risks of using cannabis with our patients, and then providing appropriate harm reduction education. So Canada has actually had laws surrounding industrial hemp cultivation since 1998. We've had legal medical cannabis since 2001, and we're coming into the 2-year mark for full legalization of recreational or non-medical cannabis. And yet, even despite all that time, there still seems to be a lot of haziness around the laws and the regulation that govern cannabis, both for the general public as well as for us in general veterinary practice. And I think a lot of that confusion no doubt stems from information that makes its way up from our neighbors to the south. So let's just take a really quick look at some of the similarities and differences between America and Canada. The big one is that US differentiates between hemp and marijuana and the cannabinoids that are derived from hemp versus marijuana. And in the US, they use the term marijuana to describe cannabis plants that have more than that 0.3% THC that is permitted in hemp products. Canada, on the other hand, still recognizes hemp as unique, and we have our own set of specific regulations to deal with hemp cultivation, but the use of cannabinoids from hemp, so for instance, your hemp-derived CBD, is still regulated no differently than any other cannabis plant. So that's really our biggest difference. The biggest similarity is that both here and in the US, veterinarians are unable to authorize medical cannabis use. Now, 2 years ago, when recreational cannabis came into effect, Health Canada put out this very helpful chart to help us differentiate between the 3 pathways for legal cannabis. I added in a couple of those green boxes that were also important features that came out at that time. The first one being that as of October 2018, all phytocannabinoids were added to the prescription drug list. So the exception to that was if they were being sold through a non-medical cannabis or medical cannabis pathway. The other thing that changed was that as of legalization in October 2018, veterinarians and animals were added to a new product category termed health products with cannabis. And this really refers to prescription drugs that are derived from the cannabis plant. So those prescription drugs, we are included in the discussion surrounding dispensing, prescribing, administering, and so forth. Now, I've shown this slide a few times, and there still seems to be a lot of confusion. So I thought maybe some of you are more visual learners. Let's throw some pictures in there. So I've expanded this a little bit to also include hemp products because that sometimes causes confusion as well. Again, looking at that US take on hemp. In Canada, when we talk about hemp products, we're really talking about industrial hemp products. So hemp seed, non-viable hemp seed, so for nutritional consumption, hemp seed oil, these are products that you can find in the grocery store, you can find in the health food store, and they also qualify as products to be included in veterinary health products. They do not contain any significant phytocannabinoids. So hemp products as a veterinary health product must contain less than 10 parts per million of THC, no concentrated CBD at all. We also have on the other end of this graph, health products with cannabis. And so again, these are our prescription drugs. They fall under the regulations of the Cannabis Act and the Food and Drug Act. They're Health Canada approved. They contain a DIN number. They're prescription only, which means we can prescribe them if we have products that we think are suitable. And just like any other prescription drug, they've undergone the pre-market review for safety and efficacy, and based on those, they can make health claims. The other two categories are what we're generally talking about when we're talking about clients accessing cannabis products. And so that's medical cannabis and non-medical, AKA recreational, AKA adult use cannabis. And you can see by the pictures, they're pretty similar. They both are governed under the Cannabis Act. The medical cannabis for production and sale requires a federal license to do that. And then the recreational sale requires a provincial license to do that. Neither of these have any sort of pre-market review for safety or efficacy, although they are required to have certain quality control testing done, which we'll talk a little bit about as well. Medical cannabis requires medical authorization. Non-medical or recreational does not. You can walk in off the street or go online and purchase that with no interaction with a healthcare provider. And if we look at these a little bit closer, again, medical cannabis does require the oversight of a healthcare practitioner. In this case, it's going to be either a medical doctor or a nurse practitioner. Providers are able to discuss health effects. So if you have medical cannabis authorization and you call the licensed producer, their customer service or patient support staff are able to ask questions and help guide you. And that's in direct contrast with recreational or non-medical cannabis, where retail workers are not permitted to discuss health effects at all or to promote products using terms related to health or wellness. On the medical side, we do see providers having platforms that can help us track patient responses. They have a real world evidence research study in effect where multiple producers have gotten together and patients can input their information and their experiences to help us get a better understanding of what type of products are working better for certain conditions. We don't have anything like that on the recreational side when it comes to medical benefits. And I find that on the medical side, producers are often striving to keep the products more consistent. There's tighter control because they know that their patients are really relying on a consistent effect. They don't want to be changing things up too much. And The other big difference I find is that a lot of the medical cannabis providers do seem to be more willing to provide greater information about their product composition. So as Dr. Mosley had talked about, the minor cannabinoids as well as the terpene content, which I found, not across the board, but generally speaking, the recreational or non-medical products, it seems a little bit trickier to get some of that information. And then we have a fourth category that has not yet come into effect. Cannabis health products, which are different than health products containing cannabis, is a possible future classification. Health Canada held a consultation about this, and they're currently forming an advisory board to look at how they can best bring these types of products to market. And what would cannabis health products be? Well, it's a proposed new classification of products that would be intended for both human and animal products. They're non-prescription products to treat minor ailments that do not require the oversight of a healthcare practitioner. So essentially, they're going to be over-the-counter health products. And because they're health products, they would fall under both the Cannabis Act and the Food and Drug Act. And they could also contain other medicinal and non-medicinal ingredients as long as they were non-prescription. So we might see a cannabinoid product with antihistamines or with a mild pain reliever that's available over the counter, or vitamins or herbal components mixed in. These products, just like most of our drugs, would still require studies to show their quality, their safety, and their efficacy. And based on those studies, they may be able to make health claims where those studies support that. But because the government already deemed that phytocannabinoids are prescription drugs, unless they're sold under the medical or the recreational market, currently the thought is that these would be sold only through current cannabis providers. So that is something for us to keep our eyes on and look towards, because I could see, I'm pulling this out of the air, but potentially we could see something like this starting to come to market over the next 6 to 12 months. So those are really the only legal channels from which we can purchase cannabis: as a prescription drug, as a hemp product that doesn't have phytocannabinoids, so let's just drop that one out, or with medical authorization through the medical channel, or the recreational or non-medical channel through a provincially licensed retail store or provincially licensed online retailer. But how do we know if a product is legal? When our clients are coming in and saying, hey, I'm using a CBD product, how do we know if what they're using is legal? And it's really not that tough. All we have to do is ask them where they bought it and or take a look at the label. And so if your client comes in and say, hey, I'm using this CBD product because Buffy's arthritis seems really bad, ask them where they got it. If they say they picked it up at the pet store or at their groomers, it's not a legal product. If they say they purchased it online, then we're going to want to ask, well, what kind of site online? Was it a provincially licensed cannabis retail online shop, or was it a direct sale from a company that was producing it? If you're not sure, the next best way to determine if a product is legal is just to look at the label. And how do we differentiate a legal from a black market product? Well, Canada has very strictly regulated how legal cannabis products are labeled and packaged. Packages must contain a mandatory THC symbol. It's a little red circle. They also have to have a big yellow box, much like a cigarette packaging does, with a health warning. They have to state to keep out of the reach of children. The branding and the logo are very small and inconspicuous. There's limited color options. They're not going to be real flashy and glittery packages. They must provide THC and CBD concentrations or contents and list product size, producer information, and an identification number, a lot ID number. What they don't have on them is easy product recognition. All these packages tend to look quite similar. They don't provide a warning to keep out of reach of pets. They do not list the terpenes, which I wish they did. They don't list the minor cannabinoids, which I wish they did. They don't permit any dosing instructions. They don't permit package inserts, and they're not allowed to make health claims. So let's take a look at what some of these look like if you haven't been into your provincial cannabis store. This is a sample package of what a cannabis product may come in. Plain packaging, big yellow label, your red THC symbol up in the corner, and that applies even if it's a CBD dominant product and may not even contain significant THC. It still has to have that THC label. And then the logo is in the top right and is very small and inconspicuous. Or maybe you're getting a nice big bag, or more commonly what our clients are purchasing are oil products. And these are two different products, but again, you can see packaging is very similar. It's not like food where your clients are going to come in and say, oh, it's the one with the purple bag and the poodle on the front. It's going to be a black or a white bottle with a big yellow warning label and a red THC sign on it. So it's really important that we're helping guide our patients and make sure that the product that they're using is the most appropriate one. Now, if we compare that to some of the non-legal products that are out there, you can see the incredible difference. Full disclosure, I'm not familiar with any of these products, so I can't comment on their quality. I have seen very good products and I have seen very poor products sold outside of the legal channels. But it's really important that both you and your clients understand the difference. So if they come in with something that has a picture of a dog or a cat or little paws on it, that is not a legal cannabis product in Canada. And why is that important? Why is it important that we're directing our clients to purchase legal products? Well, first of all, because they're legal, and we certainly don't want to be condoning our clients going out and supporting the black market. But second of all, there are certain quality control steps that are put in place for the legal cannabis products. They must be produced in an area with good production practices. Some producers will also go that extra step and follow good manufacturing process, which is a little bit stricter and tighter for international sale. All of the cannabis products legally sold in Canada must be laboratory tested and show their CBD and THC content. They must be tested for a range of different microbes and pesticides and heavy metals and, where appropriate, residual solvents. They have to have a tracking system in case something happens so that there can be a recall system in place, and they're not allowed to make any health claims. On the flip side, black market products are not legal. There's no GPP requirement, although some producers may follow them. There's no testing required, although again, some companies may do their own laboratory testing. There's no tracking system required. If a black market product has a tracking system, that's a great step forward. But again, these are still not legal products, and there's no one looking over their shoulder to enforce these rules. And black market products will often commonly make health claims, and some of them are quite brazen and can lead to a lot of client perceptions and misconceptions of what these products may be able to do for their pets. In terms of our health products with cannabis, so these are our DIN-containing prescription drugs, we really only have two. So there's not much for us to know here. We have Sesamet, which is actually a synthetic THC-like cannabinoid product. It's approved for the treatment of nausea and vomiting secondary to chemo. And then the one true cannabis-derived product that we have is Sativex, and it's approximately 1-to-1 THC to CBD oral spray that's peppermint flavored. It does have a range of other minor cannabinoids and non-cannabinoid components, and it was approved for the use in patients with MS related to muscle spasticity, although we have seen its use starting to expand to other conditions as well. So let's just recap some of that. Number one, can veterinarians sell cannabis products? The answer is no, not if they contain phytocannabinoids, unless of course they are Health Canada approved prescription drug with a DIN, in this case Sativex. Hemp products that meet the criteria for veterinary health products can be sold, but again, these are not products that have any significant cannabinoids in them. Number two, can veterinarians authorize medical cannabis use? Nope. Although we're still working to get veterinarians included under that portion of the regulation that refers to medical cannabis. Currently, it's only physicians and nurse practitioners that can authorize medical cannabis use under the cannabis regulations. And so what exactly can we discuss with clients who want to use cannabis for their pets? And I know this is where I think a lot of us really struggle. And so this is where we're going to start to head into part 2 of the presentation. And this is all about talking to our clients. And we at the CAVCM have worked really hard to communicate with other veterinary organizations. And we're really proud of the work that's been done over the last 2 years to help us do just that. Our discussions with clients should always be factual, and they should always focus on harm reduction education. All Canadian adults can now go out and legally purchase cannabis. Nothing stops them from using that on their pets. And so it's incumbent on us to make sure that they're doing that as safely and responsibly as possible, making sure that they have the information that they need to choose the safest products, watch for potential drug interactions, and administer it appropriately so that our patients stay safe and we can work together towards optimal health. Here we go. Everyone ready for part 2? I need coffee, hold on. All right, let's do this. At the most basic level, again, all discussions should focus on harm reduction education. If you have not heard me speak before, let's go over what that means. Harm reduction is a set of practical strategies and ideas aimed at reducing negative consequences associated with behaviors known to have inherent risks. This is the best example I can find of harm reduction education that I'm sure all of us remember. It brings me flashbacks to middle school. So again, behaviors that have inherent risks and strategies to help negate those risks. In veterinary medicine, and when we're talking specifically about cannabis use, what does that mean? Well, we know that there are several potential negative consequences of using cannabis in our patients. So our goal should be to ensure patients are safe as possible if their families choose to administer cannabis products to them. And why do we need to do it? Well, if your clients use the wrong product or give the wrong dose or use it for the wrong conditions or with the wrong combination of other medication, there's a clear evidence of risk. And we as veterinarians can help reduce that risk with proper guidance. Where are clients receiving their information now? Back in 2017, so given this was prior to legalization, we surveyed Canadian pet owners. And what we found out is most of the time, they are not getting their information from us. In fact, almost 75% of pet owners were accessing information about cannabis use for their animals from sources other than veterinarians. They were talking to their groomers, they were talking to pet store employees, they were getting information off websites selling these products, maybe chatting with friends and neighbors, or looking to companies that were selling products for human consumption. And so if we're going to take that back, we need to make sure that we're back in control and serving as a source of that information. So if we're going to mitigate some of these risks, we do have to understand what they are. And I think a lot of you probably have a good idea about what some of the risks associated with cannabis are. And the big one that I think we've probably all seen at some point in practice is THC intoxication, potential drug interactions, unexpected side effects and laboratory changes, contaminated and mislabeled products, production-related toxicities like residual contaminants, relative contraindication. So maybe there are some patients that we should think twice about using or really consider where the potential benefits outweigh the potential risks. And one of the big ones is clients delaying or discontinuing a more appropriate treatment in favor of doing something at home or natural. Nobody likes coming into the clinic anymore. There's curbside service. So they're looking for something to do at home. We need to make sure that they're doing that as safely as possible. Now, some of these topics we're going to go into in more detail in a lecture tomorrow, but let's take a look at some of these really quickly. THC intoxication, as you know, you've all seen these, they tend to have very high morbidity, but very, very low mortality rate. Most of these patients will recover very well and uneventfully with appropriate supportive care. The onset of symptoms really depends on the route that it was consumed. Inhaled cannabis will take effect within minutes. When it's ingested, which is most commonly what happens with our pets, onset can take anywhere from 1 to 3 hours. And typically the problem that we're seeing again is unintended ingestion of high THC products, particularly edibles with things like butters and concentrates. in there. Diagnostic challenges have posed problems. Urine tests are notoriously inaccurate and unreliable. We've also had problems with clients being forthright about what their dogs may or may not have gotten into, although I think that is shifting somewhat with legalization. The supporting signs that we most commonly see: static ataxia, where they're standing in one place, wide-based stance and swaying, lethargy. Contrary to what we often think about THC being an antiemetic, we can quite often see vomiting. Urinary incontinence and dribbling is one of those telltale signs, but it really only happens in about 50% of our cases. So make sure you're not dismissing the possibility of a THC intoxication just because they're not dribbling urine. They'll be more sensitive to sounds and motions and touch. They can have the head bob and the dilated pupils. Most or less commonly, we can see dogs actually presenting with agitation or aggression. They can have slower respiratory rate rather than faster. Hypotension, tachycardia sometimes as well, although more typically we see bradycardia. And in some cases, we've even seen nystagmus present. Treatment is generally supportive. We want to reduce absorption as much as possible, whether that's inducing vomiting or performing gastric lavage, administering charcoal. Just watch our electrolytes with that. Antiemetics are always a good idea, not only to make the patient feel better, but to prevent potential aspiration pneumonia if they're vomiting at a point when they're less aware and sort of those comatose or semi-comatose patients. IV fluid support. If they're really agitated, we can use sedation. If they're severely bradycardic, that's causing a clinical impact, we can use things like atropine there as well. And in those really, really severe cases, we may consider the use of antilipids because our cannabinoids are all fat-based products. And so antilipids can certainly help draw those out of the system. In terms of adverse effects and drug interactions, CBD, is often touted as very safe with no side effects, and that's not necessarily true. We have seen multiple reports that show sedation as a possible adverse effect with CBD use. Whether that's from the CBD itself or other components within the high CBD products is to be determined, because CBD has also been reported to improve alertness. Diarrhea is a common finding, particularly at the higher doses used in several of our clinical studies. And in dogs, we have seen increases in alkaline phosphatase. One study that's been done in cats, one of the cats developed elevated ALT, but we're not sure if that's directly related to the cannabis use or not. Adverse effects with THC use are generally just milder versions of what we see with intoxication. Most commonly, if we've just overshot our target dose a little bit, we may see some sedation or ataxia, but dogs quickly adapt to that. So much like something with phenobarb, it doesn't necessarily mean we have to stop that treatment. We may want to adjust the dosage, let them acclimatize, and then gradually titrate the dose back up. And with drug interactions, the two biggest groups that we usually are looking at are cumulative sedative effects. So if we're using other drugs that cause sedation, a great example is gabapentin. If a patient is already sedate on gabapentin and we're adding in a high CBD product, it's not uncommon for us to see greater sedation with that. And again, it doesn't mean we have to discontinue it. We may just want to adjust our dosing for one or both of those products. Both CBD and THC undergo metabolism through cytochrome P450 enzymes. So any drugs that impact the metabolizing of drugs using that pathway can affect our CBD and THC concentrations, and CBD itself acts as an inhibitor for several of those cytochrome P450 enzymes. So the use of CBD can actually change potential blood values of some of our drugs that are using those pathways for metabolism. Contamination and mislabeling. This is certainly a concern. We talk about this a lot with black market products. The cannabis plant is a phenomenal plant and has this incredible ability to clear the environment and help heal the planet through its act of phytoremediation and bioaccumulation. It's actually referred to as a hyperaccumulator because it will draw all kinds of impurities out of the medium it's growing in and store it in the plant. That's a great feature if you're trying to clean up a nuclear waste site. It is not a great feature when you're then using that plant as a medicine. And so products that are sprayed on the plants, products that are picked up by the plant through this bioaccumulatory process, or contaminants that occur during the processing, whether that be microbes, molds, things like that, those are all a concern for us. And we have had these studies that have looked at contamination in products that are sold over the counter, as well as a lot of concern about mislabeling products that simply don't contain what the label says it should be containing in terms of CBD and THC concentrations. And as much as I'd love to say that this is isolated to the black market products, even within Canada's legal cannabis pathways, we have had issues with mislabeling, incorrect labels being put on, mislabeling occurring, and even with things like contamination. You can see there was a study done that proudly revealed 95% of samples tested negative for pesticides. Sounds great, but that means that 5% managed to slip through the cracks. The one saving grace here is that all of those legal products do have to have that tracking system in place, so that if we identify a product that has managed to slip through the cracks, we have found something that slipped out into the market that may contain contaminants, we can get those products recalled. And what about relative contraindications? The first one I talk about is age. And usually we're talking here about immature animals. So their brains are still developing, their endocannabinoid system is developing, and there's controversy, although the general tilt seems to be to try and avoid cannabis products in those developing systems. So I would say kittens and puppies under 6 months, or possibly even up to a year, really consider the risk versus the benefits. If I had a child that had seizures or that had a brain tumor, would I consider using cannabis for them? Yes, most definitely, because I think the benefits outweigh the potential risks. Would I put them on something for some mild anxiety going to school? Probably not. So again, make sure you're weighing the benefits and risks. Severe heart disease, there are some reasons why we might want to consider using cannabis for heart disease, and particularly CBD products, but products with THC have been known to cause arrhythmias, as well as hypertension on initial consumption, followed by orthostatic hypotension. And so again, severe heart disease, I'd be cautious. Pregnant, lactating, or breeding animals, I'd be cautious. We know that cannabinoids can pass through both the placenta and the milk. So again, that circles back to fetal development. And there was a very early study that was done that showed they were using very high and prolonged doses of THC in dogs, but claimed it caused testicular necrosis. I haven't seen that in clinical practice, but if I had a valuable stud dog, again, I might think twice about the potential risk versus benefits. And impaired liver, maybe renal, but more so impaired liver function. We know that we rely on the metabolism through the liver using cytochrome P450 to break down these products. So we might want to consider dose reductions in patients with impaired liver function. Obviously, we don't want our patients smoking cannabis, but what other things can constitute inappropriate use? If your clients are using too little, they're not going to be getting therapeutic benefits. And that could be because they're dosing too little, or they're using a product that doesn't have as much in it as what the label claims. If it's not effective, they're likely going to discontinue therapy. And for clients who have reached for cannabis as a last resort before euthanasia, that may end up resulting in euthanasia of the pet. If they're using too much, on the other hand, we certainly could see issues with intoxication or increased risk of adverse effects and drug interactions. Some of the cannabinoids can have biphasic effects, so we get one response with a lower dose, but too much actually produces the opposite effect. And particularly when we get bigger patients, certainly finances come into role too, because we can very quickly deplete a client's budget using really high doses of some of these quality products. the type of product that they're using. I don't know that there's necessarily a right or wrong, but it needs to be individualized for the patient. So what format is it in? What is the cannabinoid ratio between CBD and THC? Is it an isolate or a broad or full spectrum product? Does it have the terpenes in it, or have the terpenes been removed? What's the carrier oil? Are there other ingredients in there that we need to be concerned about? And then how are they actually administering it? We know that different administration routes can affect absorption and bioavailability. The onset and duration of action is going to change depending on the route it's administered. Certainly safety is an issue. I don't want people hotboxing their cats or dogs because of the risk of smoke consumption. And then we want to find a method of administration that is most acceptable by their pet. I think it was just last week, a client actually asked me whether they could use their medical cannabis and just rub it on their cat's ear. And aside from the fact that I don't love the idea of the oil dripping down into the ear, you know, I had to tell her it's not going to be absorbed. We have no reason to think that rubbing a regular cannabis oil onto the pinna is going to result in any sort of bioavailability. So we want to make sure that they're using it in the most appropriate way. And then, of course, we want to make sure that they're not delaying a therapy that may be more appropriate simply because cannabis is viewed as a more all-natural therapy. And there is a lot of information out there for clients to find. Not all of it is good or reliable or science-based. If we look at some of the groups that are currently out there on Facebook, you can see we've got groups, Rick Simpson oil for pet cats and dogs with cancer. I'm not saying that there's not a potential role for therapies like this, but this is being overseen by non-medical professionals advocating very high THC concentrates, and they have over 12,000 followers. Cannabis for Pets with Cancer, 8,500 members. Again, non-medical professionals leading that group, as well as you just sort of get that back and forth banter going on there. We've got other groups looking at CBD for canine epilepsy with thousands of members, and then just a general CBD oil for pets with 36,000 members. We have to take back the role of educators for our clients on such an important medical topic, and we need to talk to them. I know that this topic can be really complex. And when you're in busy practice, I know it's really easy to get into the habit of just spewing out information, but we need to make sure that when we're talking to our clients, that it's a discussion, that there's a back and forth rather than a lecture. Information really does need to flow both ways so that we can provide them the best guidance. And in order to do that, we have to answer a lot of questions. The who's, the what's, where's, why, how's, when's. That's what's really going to guide us to make sure that we've got the appropriate information we need. Now, it always helps if clients bring up the topic during a consultation. And we created these posters to help encourage them to do just that if it's something that they've been thinking about. We're all busy. Clients don't always tell us when they're using a cannabis product. If they didn't need to come to us to get it, or sometimes they're just uncertain of the reaction that they will get. So we really want to make sure that we're sending them a message that we want to talk to them about this. I know that for a lot of you, your clients may not be coming into the clinic. You might want to consider putting something like this in a front window or having it on your website or putting it in a newsletter format. Again, something just to trigger their mind to bring that up if it is something that they've been considering. Now, last summer, the Canadian Council of Veterinary Regulators published a guidance document to address the issue of cannabis. These guidelines have been supported by several of our provincial regulators. I know Ontario, BC, Alberta, New Brunswick, Nova Scotia, they have all come out and said that yes, they support the guidelines that are put here. And it's really a very common sense approach to dealing with the topic of cannabis in veterinary medicine. You'll note a lot of similarities to what we're already doing on a daily basis with a number of our other off-label products. And let's just take a look at some of the points. So we may advise clients on the use, including both the risk and the potential benefits of legally available recreational cannabis. So again, legal and recreational. And they made that differentiation out of respect to our colleagues in the human medical field. The products that they have authorized for their human patients are for those human patients. And so the preference would be for us to advise only on recreational products. We're accountable for the advice that we give, as we always are. We should be vigilant about making recommendations. And because the type of product that they choose is so important, make sure that the product that they obtain is appropriate for use. I'll actually have clients snap a picture of the product and send that to me to make sure that they have chosen the most appropriate one, or the one that I specifically sent them to get. We are not obligated to advise on cannabis use if you don't think it's clinically appropriate, or if you're not comfortable doing so. If you do choose to provide advice, you should make sure that you stay up to date. Read the scientific literature, follow the updates that we put out, go to the continuing education. If you do choose to advise on the use of legal recreational cannabis, you must practice within the scope of your clinical competency. Again, the same as with anything else. You know, your new graduate coming out in general practice is probably not going to do a hemilaminectomy. You want to practice within the scope of your competency. 2, you must weigh the evidence against other available treatment options. And I think this is the most practical thing to do. We should always be looking at this as an opportunity to see if there are other therapies that may also help our patients. Consider the known or suspected risks, obtain informed client consent, monitor patients and be available in case there's an adverse reaction, and be aware it is cannabis for the potential of abuse, diversion, or misuse. So when I start this conversation with clients, I always approach it in a very open manner, but I do want to make sure that I get a few points out there right at the beginning. First of all, we may need to temper their expectations. That old plan for the worst, hope for the best comes into play here. Again, sometimes clients have been exposed to overinflated claims, whether it be on one of the Facebook groups or through marketing from companies. And so we need to make sure that they have a realistic expectation of what cannabis treatment may do. 2, stress the lack of published studies to support all of those claims that are floating around out there. I always want to make sure that they know that my goal is always to help keep their pet as healthy as possible. And part of that is balancing the risk versus the benefits for them. And I'll also be considering, are there contraindications? Are there potential drug interactions here that we need to be concerned about? And consider if the condition that they're wanting to treat is one that's more or less likely to respond to cannabis treatment. Or are there other treatments that we may want to consider using either instead of or in addition to their cannabis therapy? Part of that talk should also include a review of the legal and regulatory status. Clients often don't know that we can't prescribe cannabis or that none of the products out there are actually approved for animal consumption. So we do want to inform that we don't have products approved for animal use, and that the products that we're looking at using are intended for human consumption. Again, once new products are available for us with a DIN, we would be happy to prescribe, dispense, or administer those to patients where they would be beneficial. And again, caution them with respect to the unapproved products that are being marketed. We just have no way to determine their safety and efficacy without the appropriate laboratory testing and oversight. So after all of that, your clients still want to go ahead. How do we help them find the most appropriate product? And some of this is going to depend whereabouts you're located. There may be some people tuning in today from the US, so you guys are in a completely different ball game down there. But here in Canada, it will vary from province to province as well. But again, we just want to make sure that we're directing them to a source for legal recreational cannabis. And so what is it that we want to look for? Well, I would love to check all these boxes, that it's legal, that it's clearly labeled with CBD and THC content, and that we have a certificate of analysis or a quality assurance report available that shows both the cannabinoid and terpene content, safety testing for heavy metal solvents, microbes, pesticides, herbicides, fungicides, all the other ingredients listed, and proof of GPP. In reality, if we're using a legal product in Canada, all of the items that have an asterisk beside them, we can check off. The only ones that are missing are that cannabinoid and terpene content, the minor cannabinoids. We can be pretty comfortable in the CBD THC content. We just often don't know what other cannabinoids and terpenes and flavonoids are included. So where did they get it? If they're bringing you products, we want to know where they're getting those. We want to advise on products that are legal and have laboratory quantified CBD, THC, and tested to be free of potential contaminants. So where's the source? It might be a legal non-medical product or recreational. It might be one of their medicinal products that they're using. They may be already using or planning to use an unregulated human or pet product, or home cultivation is permitted in almost all provinces, and so they might have grown their own cannabis and made their own cannabis butters or oils and be planning to use something along that line. We also want to look at what type of product it is. Is it an isolate, so a single molecule like CBD that has been dissolved into an oil base, or is it a whole plant extract or broad spectrum product? Does it have the terpenes in, or have the terpenes been removed? As Dr. Mosley alluded to earlier, terpenes in cats, particularly monoterpenes, there's the potential that they may be a little bit more sensitive to those because they're deficient in that glucuronidation pathway, but more specifically, they also have a lot of smell. And so if we have really finicky animals, as much as I often love specific terpenes for their therapeutic effect, it can make it more palatable if the terpenes are out. What's the format? An oil, tincture, capsule, treat, topical. There are a number of different products that are legally available now. I still tend to use most often the oil forms that allow for titration and extraction technique. If it's through the legal market, I'm less concerned about the extraction technique. If they're making something at home, then I would certainly be concerned in that respect about what sort of solvents they may be using to do that. The next question, so we've sort of looked at what type of product they're going to get. So then the next question is CBD or THC. Most often, this decision is going to be based on what the diagnosis is, whether the animal is already acclimatized somewhat to THC, whether they've had recent exposure in the past, the overall impression of the patient, so age or level of debilitation, the temperament, as well as the owner temperament, because we certainly don't want to be jumping into a product with higher THC if it's the type of owner that's going to get really stressed out and worried if they see the slightest little wobbliness or lethargy, and client comfort and acceptance. Some clients are far more experienced and open to using cannabis, and others are going to be more reserved and a little apprehensive, and for those clients, it may be safer to start with a high CBD, very low THC product. Generally speaking, I mean, Dr. Mosley spoke of a lot of the different effects of CBD and THC. Generally, I think of CBD as being more supportive and regulatory. It does act as an endocannabinoid reuptake inhibitor, so it can enhance our natural endocannabinoids like anandamide. It can potentiate other drugs through interaction of cytochrome P450. Versus THC, which we'll sometimes consider due to its strong anti-inflammatory and pain control effects. CBD is great for pain as well, but we do find we can get enhanced pain management with a little bit of THC. THC has been known to have anti-nausea and appetite stimulating effects. It's definitely more sleep inducing, but if we're not really careful, we can have more undesirable effects at the wrong dose or in the inappropriate situations. And so we can sort of put these on a scale. Starting at the very top would be our CBD isolates that have no THC at all. In fact, they have no other cannabinoids or terpenes at all. It's just CBD. Following that, we have more of a hemp-derived CBD. So these would be products that have less than 0.3% THC. And these are really easy products to start with. They're ideal for starting therapy where we don't require THC or where there are concerns about using THC. Most of the products that we find here in Ontario through the Ontario Cannabis Store and our provincial cannabis retailers fall more into the yellow zone. So these tend to be CBD dominant products that still have low levels of THC. So the ratios are usually 1 to 20 or 1 to 10, and these can certainly be considered when low THC levels may be beneficial, which in many cases they can be, but we should maintain supervision. So we're going to need to provide the appropriate guidance in terms of dosing and follow-up. In some cases, quite often as sort of a second step, we may consider higher THC levels like a 1 to 4 or 1 to 1 when we're managing more severe symptoms, but we need to be doing this with direct veterinary oversight. And in very isolated cases, we may want to consider the use of a very high THC product. But again, the higher we go with the THC, the closer we need to supervise and the more careful we have to be about dosing. Still confused? I imagine clients would be as well, but stick with me, we're getting there. What about dose? We know that inappropriate dose is one of those risks that we run into. So how do we appropriately guide our clients to finding a dose? We want to advise them on the lack of specific guidelines, know that product differences can contribute to different responses, know the commonly used doses used in clinical studies, and those that can lead to side effects. And have a target dose in mind, but go slow, start low, go slow. When we're using CBD dominant products, anecdotally, doses are usually anywhere from 0.1 to 0.5 mg per kg twice a day. In our published studies, we've seen 0.5 mg per kg, 1.2, 2, 2.5. There's an escalating dose study that sort of escalated to a point where they saw response, and the response levels were anywhere from 0.3 to 4.12 mg per kg twice daily of CBD. So there's clearly no magical dose. It's a matter of finding what works best for the patient. In my practice, I'll often start about 0.5 mg per kg and then adjust that dose accordingly. And that would be with a product that was no more than about a 1 to 10 ratio.
Dr. Silcox?
Yeah.
We have eight minutes left.
Perfect, I'm speeding up. In terms of products that have THC in them, we have to be much more cautious. We know that intravenously, THC at 0.5 mg per kg can cause static ataxia, and there have been multiple studies looking at when dogs will start to see signs. Most of these are still fairly safe levels, but to err on the cautious side, I will usually aim to start below 0.1 mg per kg initially and then adjust accordingly. And I know that there are some veterinarians that are more aggressive with their THC dosing, but because there's always those individual differences, I prefer to stay low and then gradually work my way up from there. Again, the golden rule, start low and go slow when you're in doubt. Some helpful tips for your clients: start with about 1/4 of your target dose, particularly when we're working with THC, and give that just once a day at bedtime, so that if they're going to have some sedation or ataxia, hopefully it's while they're sleeping and not when they're charging down the stairs to see the Amazon delivery guy. Make sure you're giving it with a high-fat food to increase bioavailability. Consider having it in the cheek pouch for some transmucosal absorption. Increase the dose only if there's no adverse effects seen. And with THC products, make sure we're increasing the dose very gradually. When it comes to monitoring, we want to make sure we're following up with them. We're noting changes both to their cannabis products as well as any other pharmaceuticals, that we're encouraging them to keep a journal, and that we're getting them back in for routine laboratory monitoring. The CAVCM has this template journal that you can download for your clients or have your clients go to download it, and it can help keep track of the responses that they're seeing. We would encourage, just like any new drug, baseline exam and lab work, follow up a few weeks after getting to that target dose, and then reevaluating every 3 to 6 months. And finally, when it comes to the medical record, I don't think it's enough anymore to just write client giving CBD oil. You would never write using pain relievers. So let's make sure we try to get as much information as we can so that it can be as specific as possible. What's the product? What's the cannabinoid content? How much are they giving? Make sure you include the product details in there. Make sure you're documenting your conversations. Consider using a template. It's going to make your notes a lot easier to do with a template. but don't list it as a prescription. Don't use a prescription pad to jot notes down on, and do encourage your clients to keep that journal. And so just winding things up, and then hopefully we still got a couple minutes for questions. Even though we don't have a legal pathway to authorize use, most definitely provide clients with the tools and strategies they need to do it safely, but we have to ask all the right questions. The who, what, where's, why, when's, and how's. Who are they getting it from? What type of product is it? What, if any, drug interaction should we be cautious about? Where is it produced? You know, do they have a COA? Do they know where the plants are growing? Why are they using it? Is it a condition that could be benefited? Should we consider other treatments? How are they using it? When did they start it? And when do we need to see them back? So we've seen a lot of material today, and I hope no one's feeling too overwhelmed. I know as I've gone down this journey and started learning more about cannabis, it's very much one of these, the more I learn, the more I realize how much I don't know. But we're certainly always looking for people to get involved. So please reach out to us if you want to get involved with the CAVCM, whether that's through education or pet family awareness, or doing some advocacy work with us. And that's it. Thank you so much, you guys, for sticking through that. I want to give a shout out to our generous sponsor that helped support the cannabinoid track for this conference, and that's Cannabis Canada. So if you get a chance to stop by our booth and their booth, that would be great. Okay.
All right, so if anyone has any questions at home for Dr. Silcox, be sure to drop those down into the Q&A box at the bottom of your screen, and we can take it away.
Great. I see a couple questions there. I know one of them we did answer, but why don't we just hit on it again? I've seen human products approved by Health Canada that are CBD but still have low amounts of THC. Is there a safe low dose of THC? How should the use of these products in pets be discouraged, even with, or should the use of these products be discouraged even with low doses of THC? So there are a number of products on our website in our members section. I think we have a listing of about 35 different products that are currently available through the OCS that we could consider for use in veterinary patients. Most of those are CBD dominant. Some of them have no THC, some of them have very low levels, sort of in that 1:20 or 1:10 ratio. And then we have a few of them that have higher ratios in that 1:4 or 1:1 ratio. And so again, it's really just going to depend on the individual situation. But yes, we certainly can use some of these products with really low doses of THC in them. The other question, again, talking about dosing, was by providing doses, is this not like prescribing? And this was an issue that we had talking with the CBO a couple years ago as well. It comes really close to that line. But if we're framing it as part of harm reduction education, then it certainly falls within sort of our umbrella of things that we can talk about, because it's designed to ensure that they're not going to cause more problems or put their pets at risk. I see another question that just popped up. It sounds to me that it is not encouraged or supported to recommend CBD. If we can skip it, will be preferred, right? And I don't know if that's it. No one's using the term recommend in the official language of either the Canadian Council of Veterinary Regulators or the CBO or some of the other provincial regulators. And yet we use the term advising on or providing guidance for. And so, yes, we often do talk about it. And I think it's always important to ensure that we're talking about all available treatments. Clients will come to me to talk specifically about cannabis therapy, but oftentimes they're missing out on a lot of other conventional therapies or other therapies like laser therapy, acupuncture, massage that may provide some relief as well. So we just want to make sure that any of that guidance that we're giving gives a complete overview. I hope I answered that question. Was there any other questions at all?
It looks like that is it for now. Is there any frequently asked questions that you usually get with a presentation like this?
I think a lot of it has to do with having that discussion. What can we do? What can't we do? And you know, my overall advice there would be to feel free to have that discussion. Just ensure that it's factual information and that we're doing it under that pretense of ensuring that our patients stay safe and healthy.